Hey, going to be doing an update on Cano Health. They've been in the news. Got a headline today that CVS is looking to acquire these guys. I think that was a Bloomberg article, so reputable. Not some random website. But anyway, Cano Health, we've been involved. It's been a great ticker. I know several of you have been involved and been following my trades on this guy, or my buying. I haven't sold anything yet. But following, let's get to that right now. Let's take a look at the chart. So it's been a great ticker for us. It came down, like around, I think May, is when we first really started looking at it and getting serious about it. Yeah, because it plummeted down. I thought it was too cheap because they are a profitable company. Earnings wasn't amazing, but they're still profitable. And when you're profitable and you're getting trading at a discount, it's usually a decent time to at least initiate position, maybe look for a quick trade. However, they missed estimates, but their growth was phenomenal. And that's because, actually, let's get to their website. Let's go to their website. Let's do that. Shit. Oh, there's the investors. Come on. They have, let's do the slide deck. Perfect. Q2. Let's take a look. So this should have the revenue. But anyway, let's actually do a quick background as we're moving through. They are a healthcare facilities. They're healthcare in terms of providers, and they're also healthcare tech. So they have multiple things going on. They're full service. They've got hospitals, healthcare centers, primary care. They do dental, I believe, too, and then pharmacies. So it makes sense for some of these healthcare insurance companies to be, sniffing around a little bit, because if they acquire this healthcare system and it'll be part of their service, their healthcare share, they're going to be reducing expenses by having these guys. So there's not going to be back and forth. So by eliminating essentially, what would it be? Subtraction by addition in this case. So cutting expenses, and then obviously some revenue coming in as well. So I see why these health insurance companies are looking to get these guys. But anyway, yeah, here we go. So total revenue growth, $689 million, over 100%. Year over year, 80% growth in their memberships. EBITDA, that's good. Look, so these guys, membership guidance, blah, blah, blah. New centers, Florida and Texas. It makes sense. Amazing growth. Looks great. We'll take it. So, spreading out geographically. I'm sorry, I'm moving quick here, but upping their guidance. So growth in members, growth in revenue, EBITDA, adjusted EBITDA. Beautiful. All right, so that should show you what we're looking at here. Let's go to Cano. Go to earnings. Let's see what their earnings estimates are from the street. I know they're there. So they don't pull in a lot, but that's fine. So that looks good, and their revenue growth is going to be substantial. So profitable company. And now I'll say this: it's probably overvalued at this point. Let's see what they got. So valuation. Let's take a look at some of the main ones here. I know their price to sales is going to be, that's going to be great. Consider the sector. Enterprise value sales is fine. Yeah, so their PE, obviously they're not pulling in a lot of cash. Their earnings is amazing, and they don't have a lot of cash, so those aren't going to point to it. But the growth, and let's take a look at the growth. Yeah, that's phenomenal. Obviously we don't have all of them, but it looks great. Profitability is probably great too. Yeah, they're fine. These guys. So it was a solid company to invest in several months ago. Now it's basically double its price. So, the guys who've been, they've been following this and got involved, some of the members, I think there's a few of them that pulled the trigger when I was, probably sitting at a multi-bagger. I have yet to pull the trigger on any sales right now. I have not sold anything. Let's go back to buy and sell targets here. So what did we get up to? 975. So 975 for the day. I got my sell target. Sell one is at 1040. I'm going to keep those in there. I'm going to keep all my sell targets right in there because we should probably talk about the fact that Humana, right now CVS is, they're the name that's been, I think, bounced around the most. UNH was in there, United Healthcare, and Humana has also been involved. But Humana has first right to refusal, so it's possible that any of these names that come in and that want to buy it, Humana might put the kibosh on that. So we'll see how that works out. Now, why am I keeping the sell targets in? Because if, say, it is CVS, and they're going to do, anywhere probably $13 to $15 a share. That's my estimation on it. It's probably going to fade. There'll probably be a fade to it. It probably won't come all the way down. But the fact that if it's Humana and they say they're doing $15 a share, then I'll lose out on some of the upside to that. But it is what it is. I'd rather secure multi-bagger profits than sit here and not have any sell targets in. CVS says they're going to want to buy them at like $14 a share, and it just the deals fall through. So I think ultimately these guys will get bought out. I don't know what the environment and that these guys are in right now in terms of conversations between all these parties that are interested. But I'm not going to sit here and wait 4 or 5 months to hear that we wake up on Monday morning or Friday after, or, maybe it's a Friday afternoon where they just dump the fact that's not going to go through. I'm booking profits. So that's my game plan. So that's where I'm going to move on it. Cano Health overall, I have no problem if I sell and it falls right back down to the buy threshold area. I think these guys can run this thing if they wanted to by themselves. They are profitable. They are seeing growth. So if it comes back down below our buy thresholds before or after a buyout announcement, I'm willing to get in there and acquire some more shares. Long term, I'm looking 5-10 years out for these guys. Really, it's still a bio boom name because things. It's not necessarily them. It's probably more of like healthcare industry as a whole might be a little bit rough. I know that like a lot of these healthcare services and facilities owners, these big giant medical groups are having trouble with staffing, hiring people, and then hiring them for way too high a salary just to get somebody to cover some hours. So I could see why Cano wants to get out in that, and I also could see why an insurance company wants to buy them. So it makes sense. Anyway, I'll leave it there. I'll go over this ticker a little bit more this weekend with I think, we'll do it tomorrow morning, like probably 8-9 o'clock in the morning Eastern Standard Time. We'll get into a little bit more depth on Cano. And then some of the other guys that could be buyout targets. I know Signify was one of them with Amazon. There's a few more in here that we should probably touch up on. Anyway, so good luck, stay healthy, and we'll talk about this tomorrow.